Joining me now on the phone is Republican Congressman Jack Kingston of Georgia, joining me from Savannah. Representative Kingston, your thoughts after reading and hearing Barack Obama today?
Well, I think it was a good speech. I think it was sort of, the usual, if not hackneyed theme you hear at a graduation speech. It's the type thing that I think we always need to be mindful of. I think it's really ironic that the president actually mentioned that government sometimes lets these school kids down when he, in fact, and his party are killing school vouchers for Washington, D.C. kids. It's an enormously successful program in one of the worst school systems in the country. 1,800 kids are going to be denied school choice. And the irony is, here's a guy who from 5th grade to 12th grade went to private school.
But before I ask you if you're not injecting more politics into this than the president really had intended, I want to bring Chuck Todd back into this conversation with both of you. Perhaps we were listening to different speeches. I didn't hear anything. Chuck, I want to let you jump in here.
Well, no, let me go to Congressman Kingston on this front. The president, when he was a candidate, went in front of teachers' unions, talked about merit pay. Obviously, I know that this is an ideological divide. You brought up the issue of vouchers in the D.C. public schools. That clearly we know that there is an ideological divide on there. But is there some common ground between the president's position, for instance, on merit pay when it comes to teachers and where you are? And, I know a lot of folks like us that watch in Washington, and, of course, we get criticized by the left and right. Oh, stop asking about bipartisanship. But there doesn't seem to be as much of looking up, okay, geez, I can't get everything that I want these days. But the president does like one thing that I like, which is, for instance, on education, merit pay, which is something a lot of Republicans have talked about for years.
Listen, I'm absolutely ready to work with the President of the United States on merit pay. There's no question about it. I think his challenge is he going to be willing to take on Nancy Pelosi and Harry Reid, which he has not done on tax and trade or stimulus or anything else. It's going to be interesting to see what he does on health care. But, we're ready to work with the President of the United States on that. So let's go for it. But let's also talk about that D.C. voucher program, which is on the ground. It's 1,800 kids that are participating in it. It's a great program. And the President went to private schools. $16,000 a year was the tuition at the school he went to. And so and it was successful. It worked for him. Why is he now, along with Nancy Pelosi, killing it for Washington, D.C. school kids?
Well, look, it's a fair question, I think, to both of them, and I know the president has been asked about this. Congressman Clyburn,
yes.
Two questions I have. One is you had a very interesting way that you were describing what you expected to hear from the president, that you expected him to be conciliatory, that you kind of think that maybe it would simmer down the hostility that we've seen on both sides of the debate on health care. That tells me you think you're maybe in favor of a compromise. So does that mean is public option make or break for you? If the president says, I support the public option, but if you can't get enough votes with it in, I'm willing to, look at a trigger or look at other ways. Is that where you are? And you're the vote counter in the House. Yes. You're the guy in charge of getting 218 votes. Can you get 218 votes without a public option?
I don't think so, but I don't think the public option has to be a mandate. I do believe that there are ways for us to get to a public option with it being a part. Now, some people call it a trigger. I've called for setting up pilot programs to include the public option and co-ops in these pilots, and for us to then make an assessment 36 months or maybe 48 or 60 months down the road and decide what will be mandated going forward. So I do believe that we can have a health care reform bill that includes a public option that will be acceptable to people who think they don't want a public option in the final analysis.
So it's a negotiated, to sum up, it's a negotiated public option of sorts. So this is not, we've heard Speaker Pelosi say a robust public option. What you're describing, some to the left of you and your party say what you're describing is not a robust public option. Are they wrong?
We will be on our way to a robust public option if that is what a particular community, a particular state, or a particular region will want to have. I'm saying it may not be robust on day one, but we can build to that. Let's just provide for the allowance of a public option rather than a mandated one.
Chuck, it's Nancy. I think from my vantage point, I think something's going to be interesting tomorrow night, building on what Representative Clyburn said. And that is, if you look at Barack Obama, and let's just say that he's one of the great orators of our time, and perhaps, frankly, language has tripped him in the White House up a little bit. I still maintain that the word public option is now so politically charged that it's not going to move the conversation forward. What if the president tomorrow night were to imbue his talk with politics, to build on sort of the goodwill of today, but to change the words and say, forget public option, let's talk about Medicare with an earlier buy-in. Let's change some of those words so that, frankly, we can move this conversation forward in a way that has respect and bipartisanship and less vitriol from both sides.
Well, I tell you, there's a lot of hindsight right now on the entire debate, but I guess I would throw it to both Congressman Clyburn. If the phrase public option disappeared, is it too much of a political hot potato to even sell the phrase public option?
Well, I don't think so. I do believe that when you talk about option, you talk about choice, there are some things that we must do in terms of keeping costs down. Now, if you believe that we can have competition among insurance companies in this exchange without having a public option, then let's try and see. We can do that on a regional basis, but the fact still remains, if we cannot stop the doubling of premiums every 10 years, then we are not going to make health care accessible and affordable to everybody, and that's what we need to do.
Representative Kingston, you want to jump in here?
Yeah, what I wanted to say is you're talking about changing the word in order to change the debate. I think, in fact, the American people do understand what the president means when he talks about public option. What he is talking about is an irreversible first step to socialized medicine, and I think people got that. They understood it. He is an articulate guy, and so him going out and changing words and all that, I think it's a little bit late because people understand this is a guy who's on record supporting socialized medicine. He voted against the right of people to purchase health care across state lines. He's voted against, as a member of the Senate Association, health care plans. His whole goal, his whole career has been socialized medicine. So now he can try to run from that, but people do understand it, and they have rejected socialized medicine in this country.
And on that note, we're going to take a break. Representative Clyburn and Representative Kingston, thanks so much. And